Welcome to Sunday Morning with Trevor Phillips. To borrow a phrase from one of the most popular TV sitcoms of all time, this is the one with Rachel's budget. Not the fashionista Rachel Green out of Friends, of course, but Rachel Reeves. It's no laughing matter for the Chancellor. She hasn't made it easy for herself by promising no rises in taxes on working people, income tax, national insurance, VAT, which together account for 3/4 of the government's revenue. Add to that the Prime Minister's pledge to protect the health service, and we may soon be hearing a lot of another 90s phrase inspired by Friends, the Rachel cut. Miss Reeves does in fact have a new hairstyle, but I suspect that to most people a Rachel cut will come to mean criminals let out of jail early for lack of prison places, warships stuck in dry dock for lack of repairs, or local councils closing parks, going bankrupt for lack of cash. Yet the Chancellor insists there will be no return to austerity. So where could the money come from? This morning's speculation is that the burden will fall on business. Well, we won't know for certain for another 10 days. But let's hear from a man who might know. A little earlier, I spoke to the Health Secretary. Wes Streeting, we heard this morning of Chris Hoy's cancer diagnosis. Given your own experience, what's your reflection?
Firstly, I mean, he's such an inspirational guy, and I thought that was particularly true in the way that he's talked about his terminal cancer diagnosis today. I think to have, 2 to 4 years potentially left to live, and yet to maintain that optimism and positivity that has characterised his life and career, I think is actually remarkable. I also feel, and I've felt this for the last few years, since my own brush with kidney cancer, very lucky, because with cancer, it can go one of two ways. You know, you can survive and thrive, and we've got much better cancer treatment now than we've ever had available. But then in cases like Chris's, you've got a terminal diagnosis and a life-ending diagnosis, a prognosis, and that I'm just in awe, actually, of just how he's kind of dealing with that, because I'm not sure how I would react in the same situation.
Well, of course, it's we hear a lot more about it. For example, the King is living with cancer, with his treatment. What would you say, I guess, to anybody who themselves may be experiencing that?
I mean, firstly, timing is everything with cancer. It's really important if you have symptoms that you go and get checked, because faster diagnosis means faster access to treatment, which means potentially life-saving outcomes versus the alternative of putting it off. Cancer doesn't have to be a death sentence in this country anymore. We've got better treatment available, but those outcomes are largely determined on how quickly the NHS can get to you. So it's really important that people come forward. And, you know, regardless of the state of the NHS, and it really is in a truly awful state at the moment, don't let that put you off going to seek care and treatment if you need it.
Let's move on then to talk about the NHS in a moment. But of course, the big story of the next few days is going to be the Chancellor and her budget. She says she'll have to fill a £22 billion black hole, day-to-day government spending. And some people are saying it's as high as 40 billion. What's the truth?
Well, I mean, it is true that we have walked in both to an enormous black hole that needs to be plugged, and also, when you look ahead to the coming year, there are inevitably a whole series of pressures that need to be met, and that's before you put a single penny into the things that you want to do as a new government. And the challenge that the Chancellor's got, and it's not just the Chancellor's, this is a team effort, is there isn't a single part of government or the public sector at the moment where there aren't real crises. I mean, the NHS one is very visible, but you look at the state of our prisons, you look at crumbling school buildings, you look at creaking transport infrastructure. Right across the board, there are any number of things they could do, and we can't fix 14 years in one budget. So this is a process of priorities, choices and trade-offs, and that's what she's having to weigh up.
Well, you're in a special situation here, aren't you? Because, well, number one, you spend pretty much more money than any other member of the cabinet. And just to give viewers a sense of the scale here, the NHS alone is spending £1 million every 3 minutes. So I'm going to keep I'm keeping a clock on this interview, see how much money we get through while we're talking. But there's a very interesting issue for you, isn't there? The government says, or the Prime Minister says, that he wants to protect the health service. Health service bosses, say they need an extra 3.5%, as you say, just to stand still. 7 billion more. Is that what you're going to get? 9 billion we're hearing?
Well, I'm not going to get into specific figures. I've settled with the Chancellor, but we're not going to fix 14 years in one budget.
You've done the deal with her?
Yeah, the important thing for us is that, yes, we grip the crisis in front of us today, but we also make the right decisions now for the long term, and particularly with that totaliser we saw running on the screen. I'm conscious, and have been since opposition, that every penny that goes into the NHS, especially at the moment where money is tight, both in people's pockets and across government, is a penny that could have been spent on tackling child poverty, on public transport or support for disabled people. Like, there's a whole number of things that we could do, and that's why our focus isn't just on investment in the NHS but reform, because we've got to improve the productivity of the system, we've got to get more bang for the buck, and crucially improve patient outcomes, which are in a pretty shocking state. I want to come
to all of that, but I just want to ask you something about the politics of this first of all. Let me show you the pattern of spending by major departments over the last few years. Health consistently gets a massive uplift. It's tough for prisons and courts, for police and immigration, for local authorities. Can I give you a friendly warning? You're taking on Shabana Mahmood, Yvette Cooper and Angela Rayner, who are all going to hate you because you get all the money.
They'll probably hate me anyway. No, I'm joking. Look, there's a serious point there, which is you've got you look at all of those issues, any one of them would be important in and of itself. And
you know what it means.
And it's why...
It means bankrupt local councils.
Yep.
It means prisoners' early release.
And we've inherited all of those problems. And
you've made some choices about what you do.
Well, hang on a second.
You can't keep saying you've inherited...
Well, no, hang on a second, Trevor. I don't think any government has ever come in to find prisons full to bursting, to the extent that when people are engaging in thuggish riots on our streets, there's a genuine question about whether there'll be prison places to hold them. I don't think any government has come in with a scale of crumbling state infrastructure, from hospital buildings to schools to prisons to transport infrastructure.
OK, so you're going to be...
There is a real challenge.
You're going to be raising your hand for more money for Shabana Mahmood, then?
Well, look, what we are doing as a team is trying to balance the risks, choices and trade-offs, and that's what this budget will be about, is fixing the foundation so we can go to a better future. And it's why, by the way, though, and this is why I bang the drum so hard for reform in opposition and now in government, because I know that unless we start to bend the curve of cost pressures and demand on the NHS, which is why you need health service reform and public health reform, we will continue to be in this situation where money that is going into the NHS because of that burgeoning demand comes at the expense of either money in people's pockets or other public services that desperately need investment.
I want to come on to, actually, that whole issue of money. But actually, since you've raised the issue of reform, what is the reform? I mean, what's the big reform? I mean, it can't just be we're all going to get a watch, is it? That's not profound.
There are three fundamental shifts in the way the NHS works. A shift out of hospital into the community, better primary care, community care, care in people's
Everybody
homes.
says that. Every government says that.
Hang on, let me finish the point. A shift from analogue to digital, making sure that we're not just benefiting from, but driving the life sciences and medtech revolution in this country. And a shift from treating sickness to preventing it in the first place. And that is why tomorrow myself and the Prime Minister are going to be launching the biggest national conversation in the history of the NHS to put together the 10-year plan, but we've also wasted no time in cracking on with reform already. So in terms of reducing waiting lists, for example, not only am I ramping up the number of appointments being delivered in the NHS, but I'm also reforming the way we do it to make it more productive so that we can get through waiting lists faster
what's the reform?
and in a more productive
What's the
way.
reform? Nobody wants a conversation with you and the Prime Minister. They want a conversation with their GP and they want it faster than 6 weeks. What is a reform that is going to deliver that change?
Well, for example, I was just literally just saying about what the reform looks like. Take waiting lists. We have got in some hospitals techniques to bust through waiting lists in a much more productive way. I mean, one London hospital doing as many procedures on a single Saturday as they would normally do in the entire working week. That is more productive. It is better use of taxpayers' money, and it gets people seen faster. And in a matter of days, we're going to be sending crack teams of clinicians into hospitals with the high, not just high waiting lists, but high levels of economic unemployment, so people who are off work, off sick, because that is how you get waiting lists down, but also not just get people back to health, but get people back to work.
You've got the doctors on side for more working at weekends, then?
Well, look, I mean, the fact that we came in, and again, within a matter of weeks, ended strikes from junior doctors means that we're going into this winter able to face winter without having to contend with strikes at the same time.
Yeah, that's because you gave them a load of money. As Aaron Bevan said at the start of the NHS, you stuffed the doctors' mouths with gold. But what did you get in return? Have they agreed to new working patterns?
Yeah, I mean, it's already happening in a small number of hospitals, but we want to see it happening more broadly. Like, don't underestimate. Don't underestimate.
They've agreed. BMA has agreed, is it?
Don't underestimate.
The BMA has agreed that they're going to work more in the evenings
Let
and
me finish
weekends.
the point. Don't underestimate the extent to which NHS staff are sick and tired of seeing the state of the NHS and the poor outcomes for patients, and are ready to put their shoulders to the wheel with a reforming Labour government.
You're not telling me that the BMA has agreed?
I don't think the BMA have criticised that policy. I've not seen them criticise that policy.
OK, all right. So we'll check and see if they think it's OK for them to be doing extra
NHS staff want to get waiting lists down faster. They care about their patients. What they've had to contend with for 14 years is a government that's tied their hands behind their back. But look, in the last, just to recap, in the last few months, we have ended the junior doctor strike, put the money in to employ 1,000 more GPs onto the front line. We've already legislated to ban the targeting of junk food at children. In a matter of days, we're going to be sending crack teams of clinicians into hospitals to improve productivity. We're going to have our elective recovery plan that will get NHS waiting lists down faster, a budget that will help us to fix the foundations of the NHS. And we've done that in just 3 months.
Some of the changes, but let's just return to the amount of money that the NHS is soaking up. And I've got to say that even you yourself said, actually, that it's going to take a large chunk of money just to stand still to deal with the winter crisis. And the fact is that the Darzi report that you launched a month ago said something very interesting. The NHS was swallowing more money to deliver less. Since 2019, funds had gone up, staff numbers up by 17%, but the number of surgeons, some number of operations being done by surgeons, down 12%. Any doctors and nurses seeing 18% fewer patients. What is it that you are going to do to stop us throwing good money after bad?
Well, the Darzi diagnosis is evidence that pouring more money in without reform delivers poorer outcomes. And that is why the shift from hospital to primary and community care is vital, because you put the right resource in the right place to diagnose earlier, treat faster, better for patients, better for taxpayers. If someone can get a GP appointment, it costs the NHS about 40 quid. If they can't and end up in A&E, it costs about 400 quid. It's a really good example of how patients get a poor experience and the taxpayer gets poorer value. This coming week, we're introducing a data bill to Parliament that will enable us to better share patient records across the NHS that could save around 1.5 million hours a year just through better data management. And it's why in this budget, the Chancellor and I are prioritising investment in capital and tech to improve the productivity of the NHS. That is how we're going to get better value for taxpayers and better outcomes.
The Chancellor's got to find
for
the
patients.
money from somewhere. You voted against freezing tax thresholds that would have brought 1 million people into high tax bands when Rishi Sunak did it. Presumably, if Rachel Reeves proposes that next week, you'll be voting against it.
Well, I'm not going to speculate on what the Chancellor might do in the budget, because
I'm not asking you to. I'm asking you.
We're days away. It's her budget.
I'm asking you whether you would vote against.
If you're asking me, am I going to vote against anything in the Chancellor's budget, the answer is no. Of course, I'm not going to do that. And I don't know. You've got me at a disadvantage here, because I genuinely don't know what the Chancellor does on the money-raising side of the budget.
Okay.
All I know is where the money's going in my little corner of the universe in the NHS.
Let me give you a chance to suck up to the Chancellor. Here's what she said.
Oh, I've already done that in the budget process.
Oh,
I've read all this stuff about sending letters.
There can never be enough sucking up to the Chancellor. Let me show you what the Chancellor said about the whole issue of freezing tax thresholds. Your leader called it a stealth tax. And Rachel Reeves said, government's picking the pockets of ordinary working people. So why don't you tell me that you think, as the Chancellor did, that this would be a really terrible idea?
Well, what I can tell you ahead of the budget is that this country is paying a heavy price for Conservative failure, and we're going to have to make. And we're going to have to make. We're going to have to make some big and difficult choices in this budget to make sure we fix the foundations of the economy and we don't end up back here. The Chancellor and the whole government are going to have to make difficult and big choices in this budget to stabilise and fix the foundations of our country so we can build a better future. And what we're not going to do is duck the difficult decisions, have government by gimmick, short-term sticking plasters, because that is exactly how we've ended up in this situation.
Despite the fact you think it's a bad idea, you're not ruling it out as you have with rises in income tax, VAT,
there are
insurance.
A whole load of choices that we will have to make that we would have preferred not to. But if we don't make the choices now, we will end up paying a much heavier price for failure in the long term, and we're not prepared to do that. We're going to make the right long-term decisions for the country.
So that's on the table. Let me ask you about something that all cabinet ministers who come in here say. You use the phrase working people all the time. It's not entirely clear who you're talking about. Let me show you. There are 5 different ways that working people seem to be defined, including 2 or 3 from Chancellor, Prime Minister, and you yourself. And then there's the legal definition. Let me just see if we can get something clear. Does your definition of working people include the 4.2 million self-employed individuals who pay national insurance on their earnings?
Well, of course, self-employed people are working people. And look, but when I'm thinking about these sorts of choices, and to pick my own quote, which I think is a very good one, obviously, when I'm thinking about this budget and its consequences, I'm actually not thinking about people on my salary or your salary, even though we're both at work, we're working people. I'm thinking about people like my mum, who's a cleaner, or my dad, who's a car salesman, people who are on lower or middle income who get towards the end of the month and find they've got more month left than they have money. I'm not worried about me, I'm not worried about you, but I am worried about people who are struggling to make ends meet at the moment. Why is it then that in the legislation that you're going to introduce tomorrow on workers' rights, you don't redefine workers to include the self-employed? Because currently, workers does not include the self-employed. Well, self-employed people have a different working arrangement, and so there are lots of things, lots of protections that we're introducing for working people. They're about making sure they're treated fairly by their employers. Now, that obviously doesn't apply to the self-employed because they are their own employers.
So just in the same way as you told us that there'd be no rise in national insurance, but suddenly there's rise in national insurance for employers, it's just still possible that there might be rises in taxes for the self-employed because they're not workers.
Well, firstly, just to be clear about this, we will keep our manifesto promises. Despite the pressures, we will not increase income tax, national insurance or VAT on working people. That was the commitment we made before the general election, and we will stick to it. And just to recap, before the election, we had people like you and every other journalist saying, oh, your manifesto isn't bold enough, you're not spending enough money. And this is exactly why we made responsible and disciplined choices in our manifesto. You know what? Because we're going to keep all those promises.
I want to do now? I want to say, I take that answer, but terms and conditions apply.
What do you mean? Absolutely not. And in fact, I remember distinctly before the general election, the Conservative Party, Laura Trott, listing in a very tedious
you're going back to the Tories. I'm talking about your pledge.
I'm talking about our pledges. So Laura Trott, the Chief Secretary to the Treasury, under the last Conservative government, listed a whole load of things that we hadn't ruled out, including employers' national insurance rise. Now, I don't know if that's going to be in the budget.
I would love to...
But we did not rule out that or a number of other things because we were very clear in our manifesto that every single promise we made was a promise we could keep and the country could afford, and we're going to deliver every single bit of that manifesto.
I would love
to change the country.
I would love to carry this on, but we are out of time. Wes Streeting, thank you for your time this morning.
What's the totaliser total after that? That's what I want to know.
It's gone way too much.
Well, I'm going to do my best to improve the productivity and bring it down. Thank you very much.